Hello and welcome everyone. Today we'll be discussing the recent definition that was given for long COVID. So before that, let's see some patients who have been suffering from this. Patient 1 is a 38-year-old woman of color, previously healthy, working as cook and hairstylist. She developed Raynaud's phenomenon, Sjogren's syndrome, and scleroderma after caring for families members who had COVID-19. She lost fingertips, part of her thumb, with limited hand and foot functioning due to the gangrene related to the scarring. Lost her job, insurance, and is in financial distress. Despite severe physical limitations, her disability claims have been rejected multiple times. So it also has emotional impact where she has profound loss of identity and self-worth due to her inability to perform her former roles, particularly as a caregiver. Case 2 is a 28-year-old man who was previously a mechanical engineer, now working in surgical device design. After mild initial COVID infection, developed severe post-exertional malaise, memory difficulty, and neuropsychological dysfunction, including early dementia. He has been diagnosed as long COVID and postural orthostatic tachycardia syndrome, POTS. The physical abilities are drastically declined, affecting his work and life goals, such as becoming a caregiver for his sibling with Down syndrome. Emotionally, he experiences intense fear, frustration over his worsening condition, particularly with severe cognitive impairment that hinder his professional and personal life. Last case is a 75-year-old retired professor of modern language with PhD and previously healthy and active. He was initially infected with COVID 19 in October 2022, followed by severe rebound symptoms. She now suffers from POTS, fatigue, headache, neuropathy, and other long COVID symptoms, with positive tests for microclots and Epstein Barr reactivation. Long COVID has severely restricted her physical activity, ability to travel, and socially engage, leading to feeling of isolation and imprisonment. She experiences hypervigilance and profound sense of danger from the external world, leading to reluctance and incapability to re-engage in her social life. So, these are some common themes of profound life changes. All patients experience a significant change to their daily lives, identity, and ability due to this long COVID. So, they also face severe emotional and psychological impact where the disease leads to a feeling of loss, fear, isolation, exaggerated physical symptoms, and patients face challenges in assessing appropriate care, securing disability benefits, highlighting systemic issues in recognizing and supporting this long COVID sufferers. So, the perception of COVID 19, the pandemic was widely viewed as a dangerous acute outbreak, causing over a million deaths in US alone and 70 million worldwide. Post pandemic, millions are suffering from chronic, systemic, and often disabling conditions, collectively what is called as long COVID. In US, the prevalence is around 7% in adults and 1% in children, and globally, over 60 million people are affected. There is a lack of consensus on how to define long COVID. The novelty and the diverse symptoms of long COVID has led to various definitions, none of which have gained wide acceptance among patients or clinicians or researchers. The National Agency of Science, Engineering and Medicine, NASEM, was tasked by the US government to develop a better definition for long COVID that considers patient needs and also takes into account the expert views. So the process involved discovering, appreciating the severity of long COVID. Early skepticism existed, especially among clinicians familiar with the post ICU syndrome, as long COVID symptoms kind of mirrored this. Now, the hypothesis that long COVID was similar to the post ICU syndrome was challenged by similar symptoms appeared in thousands of patients who had even mild symptoms and some who had never been even hospitalized. Patient advocacy groups played a significant role in raising awareness about long COVID, established themselves as citizen scientists, and coining the term long COVID. Long COVID is seen as a part of broader spectrum of chronic condition linked to infection, similar to myalgia, encephalitis, chronic fatigue, post-treatment Lyme's disease, and multiple sclerosis. The committee aimed to create a definition for long COVID that legitimizes this condition, provides a pathway to therapeutic solutions through future clinical trials. Now, the committee found no standard guidelines for developing a disease definition apart from some cautions, such as avoiding the stigmatization. The five key criteria for the definition are accuracy and precision, ensuring that the definition is scientifically accurate as well as precise. The definition should be practical and applicable in the real world. It must be acceptable to those who are actually affected, that is, the patient and the healthcare providers. The definition should be easy to understand and accessible to a broad audience, because here we are primarily dealing with lay persons, that is, patients. Balance and benefit harm. The committee aimed to balance the benefits and the potential harms of making such a diagnosis, including the effects on the health equity, avoiding unintended consequences of load on the healthcare system. The committee emphasized the importance of engaging with long COVID patients and fostering interdisciplinary dialogue to ensure the definition's transparency, accuracy, relevance, usefulness, and acceptability. The process included systemic engagement through focus groups, a questionnaire, a public comment portal, and public meeting, including a 2-day symposium. Over 1,300 participants, including patients, caregivers, public health professionals, researchers, policy and advocacy experts, and members of the public, were involved in these activities. The committee served input from broad spectrum stakeholders, that is, from patient demographics, geographical areas, as well as from interest groups. The detailed finding of the engagement process were published in a publicly available document, that is what we heard, engagement report on the working definition for long COVID. The committee also reviewed existing definitions of long COVID and analyzed relevant primary literature and reviews. So there have been some core descriptions for this definition. This 2024 definition has three-part framework. That is, a core description. Long COVID involves symptoms or conditions that are intermittently or continuously present for at least 3 months. These can either persist from the acute infection, or it can also be a delayed onset. Characteristics of the symptoms and condition. The common symptoms include post-exertional malaise, persistent fatigue, difficulty concentrating, memory changes, recurring headaches, lightheadedness, sleep disturbances, shortness of breath, cough, problems with taste and smell, GI issues. Associated diagnosable conditions include cognitive impairment, mood disorders, cardiovascular diseases, and others. And it had some important features. The long COVID can affect individuals regardless of the demographic or pre-existing condition, and can persist for months to years, and is diagnosed clinically, can significantly impair daily functioning, and it is not a diagnosis of exclusion. Diagnosable conditions. These include new or worsening conditions such as cognitive impairment, cardiovascular issues, chronic kidney disease, and various syndromes like myalgia encephalitis, chronic fatigue, and postural orthostatic tachycardia syndrome, or POTS. The important features are affects all demographics and persist or resolve over a different time frame. Now, no conclusive biomarkers exist, so diagnosis is essentially clinical. Significant impact on daily life, including the ability to work, attend school, or care for oneself. And finally, important thing, it is not a diagnosis of exclusion. Terminologies. The adoption of long COVID, the committee adopted the patient coined term long COVID due to its simplicity, the wide understanding that the audience has right now, and the ease of communication of this term. Now, the term disease state was chosen to emphasize the seriousness of the condition, to avoid the negative connotations associated with terms like syndrome, which might imply a condition without any physical basis. Let's compare this with previous definition. As per the protocol, the definition is designed to be inclusive and be understandable to all. The symptom duration must be at least 3 months to meet the definition, and the period may begin after the period of apparent recovery following an acute infection. Now, equity considerations. The definition explicitly includes a focus on health equity and does not require prior proof of SARS-CoV-2 infection, recognizing limitations in early testing and antibody fluctuations. Diagnosis beyond exclusion. Unlike other definitions, this definition does not treat long COVID as a diagnosis of exclusion. It acknowledges that other diagnosable conditions may coexist with long COVID. And clinical judgment. Accurate assessment of long COVID requires expert clinical judgment, especially when differentiating between exacerbation of a pre existing condition and a new diseases caused by the long COVID. Underlying conditions, autoimmune diseases and new onset immune dysregulations are associated with long COVID. Studies show a higher likelihood of developing autoimmune infections in individuals with COVID 19 compared to controls. So the key features of the definition are no requirement of a confirmatory testing. This definition allows for the possibility of asymptomatic prior infection without the need to confirm a pre-existing SARS-CoV-2 infection, acknowledging there are limitations in early tests as well as in the antibody levels. Evidence from large cohort studies indicate that COVID-19 increases the risk of immune diseases with as much as 3 hazard ratio. There are some limitations to the definitions. The lack of definitive biomarker is there, and circularity in the definition. There is a circular issued in using symptoms to define long COVID and then attributing the symptoms to the condition itself. So the 3-month threshold should not be interpreted as a reason to ignore symptoms before the period. Early symptoms still require careful assessment and treatment. So it is not that you have to wait the patient to suffer for 3 months, then only you have to make the diagnosis. Now, inclusivity and diagnostic sensitivity. The definition's inclusivity results in high diagnostic sensitivity. That is, there will be few false negatives but more false positives. Clinical application requires careful consideration for alternative causes and relies heavily on clinicians' judgment and experience. Research considerations. Criteria for research. For research purposes, additional criteria, that is specific age, demographic features, SARS infection, may be needed to test specific hypotheses. This would help ensure that the research participant meets some stringent criteria. And erroneous classification. Misclassification in research can reduce the statistical power to detect and treat effects and disease mechanisms. For clinical and public use, while long COVID can affect anyone, certain groups are at high risk, including women and those with repeated infections and more severe initial infections. Clinicians should consider these as risk factors when assessing patients. Now, while comparing long COVID with other infection-associated chronic conditions, this could dilute the focus on distinct clinical entity, and this might also stimulate new research into causes and pathophysiology of these conditions. Immunization. The report does not consider evidence that the possible association between immunization and the risk of long COVID. However, a large observational study suggests that vaccinated individuals with later become infected with SARS-CoV-2 have lower incidence and burden of long COVID. Importance of standard terminology. The adoption of a standard definition and terminology of long COVID can enhance understanding of the condition, nature, scope, and its burden. The CDC estimates the approximate 5,000 deaths in US have been attributed to long COVID, and this is likely to be a significant undercount. The 2024 NASEM definition leverages patient experiences and expert input from various fields, providing a solid foundation for future research. The report advocates for the adoption of this definition. The definition should be revisited every 3 years. A standard definition will improve communication between all the stakeholders. And ultimately, the definition aims to contribute more compassionate, effective care to all patients diagnosed with long COVID. So, to summarize, the patient may or may not have a documented infection with SARS-CoV-2, but most likely they will have some kind of it. And the patient can have any symptoms. It can be mild to even severe symptoms. The pathology of long COVID is cognitive impairment, migration, stroke, mood disorders. This is if the symptoms are neurological, interstitial lung disease and hypoxemia, cardiovascular arrhythmias and blood clots, chronic renal disease, myalgia, encephalopathy, chronic fatigue, lupus and other autoimmune disorders, postural orthostatic tachycardia syndrome, mast cell activation syndrome, hyperlipidemia and diabetes. All these are part of long COVID. Now, important features is that long COVID can affect children, adults, regardless of the age, sex, and location. It can resolve over a period of months and persist for years. It can be diagnosed on clinical grounds. No biomarkers are required. Long COVID can impair affected patients' ability to work and as well as the emotional state. And it is not a diagnosis of exclusion. So, any patients who has these type of symptoms and probably has had a infection of SARS-CoV-2 in the future, we don't need proper documentation for that, then you can consider it as a diagnosis. You don't need to make it a diagnosis of exclusion. It is diagnosed when symptoms or conditions are intermittent or even continuously present, but for at least 3 months. It can be continuous from acute onset itself, or a delayed onset can also be done. So this is the overall definition. You can use this to diagnose long COVID. Thank you for your patience.